Hi, my name is Madeleine. I will be doing my ISM presentation for the fall semester of 2019 on what an urgent care is and why you should use one. So disclaimer, not all of this information is of my own. I did use outside sources in creating this PowerPoint, and I will have a bibliography at the very end citing everything. So these are pictures of my mentors. This is nurse practitioner Jim Patson, and this is physician's assistant Angela St. John. I shadowed at the Urgent Clinics Medical Care on Creekside, right next to the intermediate school on 518, so it was just a walk away. My mentor, Jim, he has work experience in emergency rooms and at a women's hospital. He's also worked at the urgent care for multiple years. My other mentor, Miss Angela St. John, has 13 years experience. She worked in an ER for 8.5 years before she started working at the urgent care clinic a few years ago. So what is ISM? ISM, or Independent Study Mentorship, is an advanced academic program for high school juniors and seniors who you have to apply the previous year and then get accepted into the following year, where you choose a career field or job of your choice that you're interested in and want to get more of a hands-on experience in, and it allows you to find a mentor in that said career field. You get an intern, basically shadow, see what it's like, so you can really get a grasp of what you want to do later on. So in this program, we have some requirements because it is really free for the student. It is very independent. Ms. Daffrin really acts as a teacher to give us papers to help us complete this final presentation. So some of the things we do in class weekly is our activity logs and our weekly journals. So on the activity log, we log all our hours, a minimum of 2 hours of activity, which our activity is working on our ISM assignments, and then 3 hours minimum a week of hanging out with our mentor, learning stuff, and if we can't come, we write it on the log just to be like, hey, couldn't come for X amount of reason, and that's it. And it kind of acts like a little notes, like you do brief bullet points of what you did, and in the weekly journal we do, the Monday the following week is more of a summary and a more detailed explanation of what we did. Another thing we do is our weekly portfolio, which is an online portfolio we make, where we have all of our assignments we've done throughout this year, some of which you will not see on this PowerPoint. And then another thing is 10 artifacts from our mentorship site, which is things that are commonly seen at our workplace. Like if you are in the medical stuff, you might take a picture of a syringe, an examination table, so things that are important. So here are some of my artifacts. Here is the cough poster, something very simple but very important because children tend to get sick because they don't cover their mouths or they don't wash it. So this is mostly important for kids because they just don't know that yet. Here we have the otoscope cones. These are what doctors put on the otoscope, which they use to examine your ear, nose, and mouth whenever you first come in, just to check your basic sinuses. Next is the examination table. You sit on there whenever the doctor listens to your breathing, heart rate. There is the EKG/ECG. It is called the electrocardiogram. However, it was invented in Germany, which is why it has the K, but in America we use the C. And there is the AED. One of the prerequisites for ISM, if you're doing the health stuff, is Principles of Health Science, or HST1. And they actually have us be certified in how to use those. So it's to help shock the heart back in the rhythm in case there's a cardiac arrest. Here are the other 5. We have the sharps container where you put scalpels and needles that have been used or opened. Here is the urinalysis machine, so that's to read urine samples to see if you have a UTI or anything that's not balanced down there. The vitals cart where you take your blood pressure, oxygenation levels, pulse, and it's also where they have the temperature, ear reader, or under the tongue. There's a height and weight machine to see if you're along the growth curve or if you're overweight or underweight. And lastly, the x-ray machine to scan your chest or bones. So my project topic is what an urgent care is and why you should use one, because a lot of people really don't know. I didn't know myself what the difference really was between an emergency room and an urgent care, so I thought this is something I need to educate people on, because if I don't know it and I was there, then I'm going to assume other people don't know it. So I will be discussing the differences between the two because they are commonly confused amongst the general public, as well as some of the conditions that can be treated, the treatments offered, the conveniency, and the cost difference, because that's really important. So what an urgent care is. Here is the medical definition: urgent care medicine. Medicine just being put at the end because it's a type of healthcare practice, kind of like emergency medicine. It is an immediate medical service offering outpatient care for treatment of acute and chronic illnesses and injury. So if you are experiencing a non-life-threatening injury or nothing that is life or death, then it is the perfect place to go to, because you're just experiencing something very acute, minute, maybe a little bit achy, common cold. So nothing that needs the full resources of an emergency room. It is also very patient-friendly for people without insurance. It's convenient if you don't live in a medical-friendly place. Like, luckily for us in this area, we live right next to the Houston Medical Center. We can find the hospital or emergency room any time of day. However, people in more rural areas really can't, so an urgent care might be the best place they can find. It's kind of like a dentistry. You find them easier than you would an emergency room. And the main difference between them is the cost and treatments. Emergency room is 911 level, I'm gonna die in a few hours, I can't wait the full 2 hours to be seen. And urgent care is, I can wait 30 minutes or 2 hours and I'll be perfectly fine. So when you should go to an urgent care. So as I said, if you're not experiencing severe trauma, then the ER just isn't for you. Because if you do go there, you'll be taking away the resources that a patient who is experiencing a life-threatening issue would need, such as the staff or the equipment. So it can be really detrimental to other people if you choose the wrong one. But most importantly, it can be very detrimental to your wallet, as we'll discuss in the next slide. Because it says here you'll be overcharged for the same treatment after waiting a very long time. So here you'll see that something a lot of people are unaware of is the change in policy for insurances overall, and this also affects the state of Texas mostly because of our vast healthcare industry. Recently, the policy was that if you were to visit an emergency room for a non-life-threatening issue, your insurance would still cover it. Now it's become, if you visit it for a non-life-threatening issue, you have to pay for it all. We're not gonna help cover any part of it. Some insurances might cover a bit more than zero, but most are just like, nope. This is to help decrease the waiting times and discourage people from using the wrong thing and taking away valuable resources from actual people that need it. Here is a graph. Red representing emergency room costs and blue representing urgent care of common things that can be treated in urgent care that people go to for an emergency room. As you can see, there is sometimes a 500% spike of how much they overcharge you, such as right here for sinusitis, so basic allergies. $112 at an urgent care versus $617, which is $500 in difference approximately, and that catches up with you over time when you keep overusing it and if insurance doesn't help you pay for it. So it really does matter. Oh, and in urinary tract infections, something we see quite often at the urgent clinic. Really simple, insurances usually cover it. If they don't, usually pay a $90 fee. If you don't have insurance, over there, $665 for a simple urinary analysis test. So the conveniency and efficiency. One of the main reasons urgent cares came to be was because people wanted something convenient and easy to go to for immediate medical treatment. Because if you're a primary care doctor, you have to typically schedule a few days in advance, and then you have to wait an hour in the lobby. And at an emergency room, the average wait time is 1.5 hours, which no one wants to wait if you're vomiting or real sick, and you also don't want to be surrounded by other people with the same issues. So the average wait time in an urgent care in America is 30 minutes, which is an hour less than the emergency room and a few days less than the primary care doctor you might see. So this conveniency is why it's really popular amongst millennials and people with children or the working class, because when you're working, you don't have time to skip your job to go to a doctor to get your cold fixed, and you don't want to waste your lunch break either. However, a quick hour lunch break, you could probably get it fixed and still have time for lunch. Or if you have small children, you don't want them to be sick for a whole week, because then that's more time you have to stay home taking care of them. So you can bring them in during weekends, which a lot of places are usually closed on weekends, like primary care doctors and emergency rooms. Here, you can walk in, no appointments necessary, with your kid, get them treated, prescribed a medicine or a shot, and they get better in the next few days. So it is really convenient when you think about the time and efficiency of how it pertains to the person that needs to either take care of the sick patient or the person who is sick. So the treatments that are offered at an urgent care. What you'll see when I bring out the brochures later is that there are various things such as numerous itises, itis being inflammation of stuff like bronchitis, osteoitis, mastitis, allergies, things we see very often, pink eye, head lice, so no need to go to a fancy salon to get your kid's lice fixed, STDs, tetanus, and poison ivy, and numerous other conditions can be treated as well. And some stuff the general public is unaware of, something I experienced my first night doing my ISM mentorship hours was, when you break a bone, you can't necessarily recast it immediately afterwards. You have to let the swelling go down over the course of a day or two. I wasn't aware of that, but instead of going to an emergency room to get it temporarily splinted for a lot of money, you could just go to an urgent care. They take pictures of the bones, can send the x-rays to your orthopedic, temporarily splint it, and if you don't have an orthopedic already established, they will have a little stack of cards of doctors in the area who could help you or are specialized in what you need, as well as Dr. Pimple Popper. She dreams the abscesses and cysts on people. You can do that as well at an urgent care. I've seen them before. They're interesting. And you can also suture certain lacerations with either staples or stitches, as well as vitamin B12 injections. Now, every urgent care is of course different from one to the other. So the one I went to, they had something that not many did, which was the hormone replacement therapy, which is what you use if you are an adult who stops producing testosterone or estrogen. So you come in with your prescribed vial of testosterone every X amount of weeks, you give it to the medical assistant, they prepare it into a shot, and then they give it to you. You go about your day, you have your hormone levels fixed. So I will bring out the brochure shortly, but this is an overall glimpse of it. This is what I created as my product, my tangible item. It highlights the differences between an emergency room, the definition I represented earlier, a tiny checklist of when and when you shouldn't go, conditions, costs, and then the medical staff. So here are the brochures. So here you'll see the team behind the scenes, which is the medical assistant, receptionist, and nurse practitioner or physician's assistant. Most of the time doctors don't really staff these. So the medical assistant will be the person who administers the shot to you, and they will also be the one who takes your vitals, asks you basic questions like how are you feeling, how long has this been going on, any medicine you are currently taking or have been taking recently. And then the nurse practitioner or physician assistant will see you, go on more detail, and ask you more questions as they narrow it down, trying to see what you have. They'll diagnose you, and then eventually they'll prescribe you a medicine or something to help fix it. And it's not always medicine they prescribe. Sometimes they'll say, oh, just drink some water with honey if you have strained vocal cords, which we've seen before. Or just take it easy. They write work notes, school notes, everything. And then we see the checklist. So if you're just experiencing a fever, you're achy, seasonal allergies, which we get down here a lot because of the constantly changing weather, from hot to cold to humid, because that's Texas, and especially near the Gulf. Your flu, which we've been seeing a lot more of, the common cold, rough/sore throat, mild abdominal pain. Now that's the tricky one, because depending on where the pain is, it could be appendicitis or kidney problems, and if that's the case, they will actually refer you to an emergency room, as well as bowel issues such as constipation and diarrhea, rashes like poison ivy or just rashes or hives in general, UTI-like symptoms, so any type of vaginal or penile discomfort down there, and of course non-life-threatening injuries. And here are common things that can be treated. Certain STDs can be treated with a shot, something I've learned, abscess removal sprains, broken bones, as well as fractured, but if the bone's broken, as my mentor Jim said, even if it's fractured, still broken. And then we had the bladder infection and skin infections. So in ISM, one of the assignments is our current event, which is we read an article based about our topic, and then we summarize it and show how it pertains towards our overall PowerPoint. So this was about emergency room, urgent care, or primary care physician, when you should go to one, the differences, when and when not to go to one, and how each one is better in their own right. So it does stress a lot in the article, only use an emergency room for life-threatening conditions like severe chest pain or difficulty breathing. We've had patients come in with chest pain, they thought it was asthma, turned out they had arterial fibrillation, and I actually called the ambulance for them. So even if you do go to an urgent care for the wrong reason, it's still cheaper than going to the emergency room for the wrong reason. And then my conclusion is that any medical location that you love and are comfortable with, go to. But if you're gonna want immediate, quick treatment and get better soon for a nice, inexpensive cost, an urgent care really is the best place for you. And it has a lot more things it can do than what we all think it could. I didn't know it had an x-ray machine. One of the first things I learned was it had an x-ray machine. And overall, I just learned that it's cost efficient, convenient, easy for kids, and school physicals and sports seasons come up. It's a lot easier than going to your primary care doctor. And then I would like to thank my mentors at the urgent care as well as the other staff for allowing me to shadow them every Tuesday and Thursday this semester, as well as ask them questions. And they treated me like an adult. They never once treated me like a high school student. They always were very professional with me, very blunt with what was happening with each patient. And I'd like to thank you too for coming today and taking your time to evaluate my project right before finals, which is stressful for all of us. Here's my bibliography, an MLA citation, and then questions, if we have any.
No, that was good.